The right one. So yes, thank you very much for the kind introduction. The only thing I'm going to add a little bit is I am also now being promoted a clinical professor at Case Western, where we do digital. I'm in charge of biomechanics, and I teach all the new technologies, which is kind of interesting. I teach conventional biomechanics to all these schools, and I also teach digital orthodontics obviously with aligners, but also with cone beam CTs and all these things. So it's really a nice mix for me, and I enjoy it tremendously. So then I need to know why this is not working. It is working now. So I'm going to push this here. Can I do that? Sorry, I can't get rid of this. Okay, yes. So the title of the lecture today is Active Memory Aligners, Past, Present, and Clear Future. And I think it's a great slide that now polymers are kind of taking our orthodontics a little bit over. And there's still a bit of a, I would say, controversy. Is the aligners going to replace braces? Are going to be doing more or less? My opinion is we are going to be getting. Where am I going to get this? Okay, we are going to be using more aligners in a hybrid system with less attachments. I'm more of an academic. I'm not a marketing specialist. I would argue and agree that less attachments are better. I'm not sure that we can do no attachments. My humble opinion is that we have a real good product now that will allow us to do more treatments compared to thermoform, or faster treatments, I should say, and probably with better outcomes. But you also have to understand that this material is really a great material, but we have been working with this for 3 years. So obviously we will need more clinical information in the near future to totally validate our claims. So this is there is a big shift in, I would say, I don't know, the idea of active memory has been with us for many years with a shape memory. I'll talk about that in a minute with night eye. I was lucky enough in my first career. Sorry, there is a bit of a problem here. But anyways, yeah. So what happens is, this is tweed. It was a fantastic treatment in the 1940s where bands were well fitted. Patients didn't like the aesthetics, but you can see that there was a lot of work and amazing orthodontic treatments provided. Then Dr. Andrews in the 1970s gave us the straight wire as the first big real revolution in orthodontics, where we supposedly simplified treatment. But at the end of the day, what we did was actually do better treatment. Because at the time I was involved with this, it was the beginning of my career. People said, oh, straight wire will basically replace orthodontists. The dentist will do all the work. And to be frank with you, it hasn't happened this way after a few years. And now we can do really cool treatment and fantastic treatment with braces. But that's not the discussion for today. And then we have Invisalign in the end of 1990s. It took quite a while for the orthodontic profession to adopt the technology, but now it's a well accepted, I would say, service. And I was with Lile in the Sido in Italy, and 90% of the booth now are basically promoting some form of aligner treatment. So you cannot, like Invisalign or not, you have to say that they made a significant change to the aligner and orthodontic market. And then we had Graphy about 5 years ago, which I'm not going to talk too much about because I'm not an expert in this technology. But then 2 or 3 years ago, we got ActiveMemory Polymer. And this is from my good friend Kelvin Chang from Taiwan, that we have these little inventions that we can use. So you can see now that these aligners can be totally programmed. We can change the shape, we can change the thickness. So this is another new, I would say, not a revolution, but a significant evolution in aligner therapy that will probably get way better in the near future. So why is it important? We are very much used now to thermoform. Again, I was one of the first Canadian orthodontists to offer Invisalign treatment in 1998, and there was some significant issues, but it got better with time, and now it's an accepted technology. Obviously, they have many companies and many aligner cases. So thermoform, the problem we have is only a pusher. orthodontics with fixed braces can push and pull. So it's a significant limiting factor. So what happens in the, I think 2012 or 13, Mr. Morton came up with a concept of attachments. My first attachment I used was in 2006. There were just little blobs on the teeth, and we tried as best as we could. And then Mr. Morton, the head engineer in Invisalign, made very complicated and very elegant attachment that changed what we did with, especially with the Smart Track system. But it still designs, if you look at aligner treatments nowadays, they have almost every single tooth as an attachment. They're pretty big. And this is the way that you can combat, I would say, or improve the push-only system of tooth movement, sorry. And now we have AMP aligners that may be able to apply a pull force. This is something that we're looking at as in academic research, is by engaging undercuts in the interproximal spaces and taking advantage of tooth shape and anatomy. There may be ways to really have finally somewhat of a same concept as fixed orthodontics, which is a push and a pull, which would make a big difference in how aligners work. And you could also argue that you can reduce the number and the size of attachments, which is something that still needs to be looked into. So the problem we have with aligners, thermoform, either actually, I don't really know with aligners, with Invisalign, but my own experience, because I was also doing in-house aligners for the past 6, 7, 8 years, is obviously we have a non-uniform thickness. So usually the incisal edge are typically thinner, but it's not controlled. So you don't order it to be this way. It happens because of tooth anatomy and the pressure that the thermoform machine would exert on your aligner material. So you don't really know what's happening there. So you don't really control the force. This one is also a problem. You cannot have with thermoform the very nice engagement that you get with, I would say, ActiveMemory polymers, because by definition, when you put pressure on the material, it has to go around the attachments and around the teeth. And if you have too much of a very good fit, you can't remove the attachments, which 10, 20 years ago with Invisalign, we had this problem. People would not remove the aligners because it was so tight, and the material was just way too, I would say, too rigid. And the problem we also have is you concentrate the stress, which people, this is a whole lecture of polymers. Polymers are different from wires. It's first of all, it's a full overlay of the dentition, and the way it reacts to deformation is still very complicated to understand, and they have very complicated stress concentration around the attachment and in the sharp edge, which reduces the force. An example, if you just put a cut on the canine for a class 2 mechanic on a thermoform, you will concentrate the stress on this particular area and reduce the obvious force application to the surrounding teeth, which may cause a problem. And again, this mission dependent, obviously, we always, in our practices, we always use thermoform machine like Dufromat, or I didn't use Ministar, but I used the other one because BioStar, because you need a lot of pressure. So if you still do thermoform in-house, please use a very strong machine, because the cheap ones will not give you the correct pressure to push the material onto the dentition. All right, so the problem again, which is the two main issues that I think ActiveMemory will be making a massive difference, is called stress relaxation and creep. So quickly, you can look at this design here on the right-hand side. What is very important is the stress relaxation means that when you engage the aligner on the patient's dentition, very quickly, the stress will relax, meaning that it will dissipate very quickly and you will lose a lot of force. So basically, the force level will drop very much. So when you give the aligner to your patient, say, oh, that's good. Look, there is a lot of force. Patient says, yeah, I can feel a lot of force. But then by the time they are back home, already you've lost about 30%. And within 12 hours, you've lost over 60%. The creep is different, and you may have seen that too in your practice, is especially on the lower sevens or on lower second molars, where what happens is after like a week, the patient comes back and you can see the aligners are kind of floating around the teeth. It's because with time, there is a deformation by, I don't know, mastication, occlusion, anything that will deform. And then what you have an ill-fitting aligner that is not doing as much as it should be giving you. So there is a significant difference between when you think you get and what you're really getting. So why is it so important? Well, the big deal is this one. If you look at this upper left side, sorry, the y-axis, is called the moment to force ratio that every orthodontist understands very well. And you go from 3 to 4, which is uncontrolled tipping, and we'll talk about that, all the way to 18, which is control of the root, which is root torque. And this is come from Burstone. You can see that when you use a thermoform aligner of good quality, there's nothing wrong with it. So this is the biggest. Oh, so you see this. Oh God, this is really good. I'm getting exactly what I want. But within 10 hours, you're down to 10, which is translation. And then after 20 hours, you're down to 6, which is uncontrolled tipping. And within 3 or 4 days, you're down to 3 or 4, which is, controlled tipping here and uncontrolled tipping. So is the force still applied? Yes. The problem is your moment to force ratio all of a sudden is only doing uncontrolled tipping. So it's time to change the aligner, because otherwise all you're doing is pushing teeth. This is why many people will tell you, I don't want to do extraction cases, because by the time I get to a certain amount of aligners, the canine is actually tipped and they have good observation. So you need very big attachments to grab the tooth, and a large number of attachments because you stay for only a small period of time into the ideal translatory movement that the canine will show. And you spend a lot of time in the uncontrolled tipping, which means that you will get tipping and you need to do refinements. So this is very important curve, in my opinion, that explains why we are a little bit worried about doing torque with thermoform. And you still get the force. You still get enough force to push the crown, but you don't get enough force to move the root. So it's a very complex system. So why ActiveMemory Polymer present probably a solution to these problems, and hopefully in the near future we'll have even better materials. This is a brand new technology, so I'm very confident that we will keep on improving on it. So what happens is, first of all, the aligner will be much more precisely adapted to the tooth. It's 3D printed. It's about maximum 30 microns, which is huge compared to thermoform. It's a very big difference. With this, if you have more precise adaptation, you should have better control of tooth movement. Again, do we need no attachment or less attachment, smaller attachment? This is still at the research level, which I must tell you about, because we have with LuxCreo, which I like about LuxCreo. I'm not in the sales department, I'm the academic, and we are actually with the engineers, we are developing partnerships with a lot of universities, very reputable universities, that will give us hopefully many of the answers we're asking at the moment in an independent setting, which makes the company very reputable and will help us get to much higher level of results very quickly. And then the problem I'm having is called displacement driven. Displacement driven is a whole lecture of mine. When you use orthodontics with braces, you use force driven. So you put a deformation of the wire will give you back a force system, hopefully the right one that moves the tooth where you want. With aligners, it's different. You will take the tooth, if you use on the computer, you will displace the tooth to a certain position, and you deduct the force system that may or may not happen. So there is still a lot of research to be done to kind of marry displacement driven, which is a liner driven system, to a force driven system, which is fixed orthodontic system. And as soon as we can get close to these two matching together, we will get to a much higher level of results. I had a question about shape memory versus active memory. So shape memory, the best brand, and there are more, 3 or 4 now on the market, is Graphy. Everybody knows about it, heard about it. It's a very popular brand. Active memory being LuxCreo. So I'm not an expert. I'm not aware of any papers at the moment published claiming superiority of shape memory over active or active over shape, but this will happen. They both are kind of shape memory in the same type of the way that we are learn with night eye wire, but they act totally differently. So the shape memory is the transition temperature. Okay, we mean when the material goes from a hard shape, hard to activated shape is low. So this is the claim of graphy. So at body temperature, the material you put it in your mouth will you put it a bit on soft sorry warm water, you put it in your mouth and then you activate it in the oral environment, so you get what the material will try to come back to its original shape and obviously take the dentition with it. So the activation, it's a one-time activation in the mouth. You will not reset it. When it's worn, it's worn. The shape recovery is supposed to be limited. I don't know about that. So this is to be determined, okay? And what happens, the clinical limitations, or actually what the company says is they are developing materials that give you a very low force, but very constant force, which is fine. The problem is if the force is too low, you don't get the movement that you're looking for. So this is the shape memory. What you have to understand is the transition temperature is at the body temperature, TA28 as an example. Active memory is a bit of a different concept, actually a very different concept, even they look the same, is the transition temperature stays very high. So at the beginning, when I was talking to the engineer at Lux Grill, because that's the first people I talked to, they said, but that doesn't make sense. I mean, I can't use a high temperature because I'm going to burn my patients. He says, no, no, no. What happens is the aligner will be reactivated at a fairly high temperature, which is 65 degrees, or you can go all the way to 80 or 90. And what happens is all the stress relaxation and the creep will be reversed and the aligner will come back to its original shape. And obviously you have to put it in your mouth when it's still warm, so it's comfortable. And then you will have as I say all the time, you have a brand new aligner every day. Okay. You still lose a little bit of activation with time, which is normal, but the loss is not that important. So as I said, the activation is you have to put this into a little machine or put it into a cup and put it into very hot water. And then you can reactivate it multiple times, which I would say the company says every 24 hours. I say if you can do it every 12 hours, it's even better. Okay, but that's again, the amount of reactivation needs to be researched. Is twice a day better than once a day? We still don't know. And then it comes back to its original shape. Basically, what I just say, you get a brand new aligner every day, every day. Okay, so you get the force delivery. So this is good. And by the way, usually active memory, I do apologize, I got the flu a little bit. Active memory usually gets a bit to a higher force level than shape memory by choice. Which one is better? We still need to do research on that. So this is the response of the engineer. I'm not going to read it because it's pretty much the same thing as I said, but I put it because now you will have it in the recording, or you can take a picture of it if you want. So this is the real head engineer that gave me this response. So it's a very good response. So I'm not going to read it, but you see it's 60 degrees for reactivation. And it does not undergo shape memory at interval temperature, which is a claim. And we claim, yeah, it's totally correct. We don't want it. We want 60 degrees. You call active memory, comes back to its shape and gives you back the high moment to force ratio that you need to move teeth correctly and predictably. So this is important. I'm going to go quickly. So when you have this deformed, so this is after like 12, 14 hours away. You can see now the yellow tells you this is with Geomagic, tells you that this part of the aligner is not doing much of anything anymore, which, well, that's a problem because only the green is pushing. So it's becoming almost I would say, uncontrolled tipping, but all of a sudden you restore it with thermal activation and everything becomes green again and you keep on going. And you can do it as many times as you want, but you still lose a little bit. You can see, oops, sorry. You go from 100% all the way down to 90, which is fine. I mean, you stay within a very narrow range of activation, so that's good. Thermoform, you're going to go down pretty quickly, and more than that, actually, eventually, you will get only uncontrolled tipping. So the precise fit, this is a nice picture from the company that I requested. You can see that you really engage. So you can see that all these surfaces right here, and you can vary the engagement as you want, by the way, in Lux design. So here you go. You see, we use different attachments, much smaller, rounder, because the material will doesn't like this. You can see the little printed lines. So it's very important to put rounded attachments because they are super precise. You can see the occlusal. So this is a great picture to highlight the difference between thermoform. And I can play this little movie, but I think you already saw it, so I'm going to play it quickly. So if you put it in hot water, 4 times the speed, you can get this. Okay? So it's coming back really nicely. This, you have to trust the company. At the moment, we have studies coming out that yes, it looks like it's the coming back to its recovery is pretty predictable and works really well. And this is the delivery activation. We use this nice picture to show you that, in my humble opinion, again, I'm not a salesman, but if I had to sell aligners using Lux Cryo to my patients, I would include this called a Rejuve machine because it's a cleaner, which is very nice. So it will bring back the nice tone of the liner. It will not let it stain, but it will reactivate really nicely. And this is the hockey stick, being Canadian. So you can see that you have a significant loss of force very quickly, but this is what needs to be understood. You stay between 6 and 4 Newton of force. Some company will say, well, it's too high. If it was with fixed orthodontics, it may be too high, but you have to understand that with polymers and aligners, you use 60 to 50 to 60% of the energy you built into the system is lost by the fact that the energy is dissipated within the material. So if you look at this and you say, okay, it's 50%, then you go from 6 to 4, which is the theoretical lab system. But when you use it on the patients, you go down to 3 to 2, which is actually what you want for complex treatment, not just uncontrolled tipping. So this is a super important concept too. This is one of my charts. I'm using it to show you. So this is braces. So you can see you lose about 90%. This is normal. There is energy dissipation within the system. This is the aligner that is reactivated from Lux Cryo. And this is the curve I showed you before. And you can see that the thermal form keeps on losing much more. And this is the big deal, is we are a little bit lower than the force delivery. And again, you have to remember, this is a removable appliance. This is a fixed appliance. They do not work the same. And we need to kind of reinvent orthodontics to take advantage of this very unique material. And this will come hopefully very soon. But you can see that the active memory gets closer to the fixed orthodontics and a bit farther away from the thermal form. Not going to bug you with this. Take a picture. This is a very cool paper. I like it. There's a trend closer to bodily movement was observed with Per T. Faline, which I can't pronounce, but it's basically the Lux Cryo system. Sorry. This is the Lux Cryo system, and we need more clinical studies. So this is a in silico, meaning we have fake dentition, and they are measuring the, I would say, the force ratio and the moment force ratio that is done on mandibular incisor. And they found that the Lux Cryo was better than thermoform and seems to get closer to a bodily movement. So that's brand new paper from Progress in Orthodontics. Take a picture. It's 2025. So you see the problem is adaptation is not that great. This is the thermoform aligner compared to the other one. Is it bad? No, it just removes a lot of potential force application because the aligners work really well when they are very well adapted to the dentition or to the attachments. Otherwise, you lose a lot of power. So this is the engagement I'm showing you. So I'm going to go quickly because I'm probably going to be late as usual. So this is the big advantage is you get into the undercuts that you can adjust and use them. So a little trick I can give you if you go into using these aligners, please, if you want to move teeth, it may be a good idea not to align them immediately because if you align everything, as a first step, like we do in fixed orthodontics, the problem you have is then the aligner has a tougher time grabbing the teeth. So if you want to move teeth around, let's say an extraction case, you may want to actually move the tooth in its rotated shape and only correct the rotation at the end of treatment because then it will work much better. So that's a bit of a different way of looking at staging, which is again another lecture we could have together. And it changes the way you think about orthodontics. Okay, so what the advantage do? Well, the big, obviously, because you can 3D print, you can print it in several configurations. You can do what you want, which at the moment, we still are working with, it's called the Lux Design System. It's still in its, I would say, not infancy, but we are working at it. We can make the aligners thicker. We can put buttons. We can make a trim line. I'll show them to you in a minute. And we can make, what I said about the block out. So if you want to not block out, you remove any type of block out. You just let the aligner flow into the space. Why? To get more purchase point when you need it. If you don't, you put some block outs. So all these are actually, at the moment, we are doing some calculations to give you a software that will allow you to do this almost automatically. At the moment, we're still working this manually, which is not optimized, but very quickly, all these, this one, the button is done already, but you have to place it yourself. So maybe with machine learning, we say, well, we should put a button here, and you say yes or no, and the thickness would be the same. For this type of malocclusion, we suggest that you put this thinner, thicker, whatever it's going to be, and you say, yeah, I like it or not, and then you can modify. So this is something we're working hard on. Okay, so this is what I'm showing you. You see the thickness here. I just push it really big to show you. So this is a negative attachment. So meaning that it's like a power ridge from Invisalign. This is a thickness that I added to put more force and more plastic here. And we can show you here from Lux Creo that you can go from 0.5 on the lingual to 0.8 on the labial, and it's a whole surface, but you can also cut it and put 0.8 here, zero point 0.8 there, and you can have a nice force couple. We'll show that in a minute. But sorry, the problem we have is H being the thickness. Every time you increase your thickness, be careful. Do not double it necessarily because it's better. It's going to go twice as the force. No, it's at the third power. So changing the aligner thickness by a couple of tenths of millimeter will make big differences. So be careful with that. Okay, so this is a case from Dr. Lehman from Florida, nice gentleman who's been a user of LuxCreo for a while. And we can see that this patient had braces before and showed a significant dehiscence. So what he did, he used LuxCreo with a thicker aligner, I think. Yes, you see, he used a thicker aligner. And this is a 2-year-old case already. I think we could do even better now, not because he could do better himself as an orthodontist, but the material and the software is already better. So now he was able to continue closing and putting the root back into bone. So he was able to put some torque on the tooth. Obviously, the bone will heal eventually, and he got really good result, and then could go for a gingival graft. So that was kind of a nice little use for this system that applies thicker here and not so much thicker there. You can add attachments as I showed you, so not going to be there, but at the moment we're also developing a library of attachments. So you could do your own attachment, do whatever you want. Again, no science in this yet, but it will get there. So at the moment, all we have is a button and a hook, which is really cool for class 2 elastics, much better than the precision cuts, by the way. And and you can make it them thinner, thicker, the way you want. So again, can we do these? Push force uncontrolled tipping. So we want to align, all this. This is pretty good. So the Straighten Orthodontics gave us the case, and it worked really well within 3.5 months. So can it round off the arches? Yes. It also, in my opinion, did pretty well avoiding uncontrolled tipping, especially at the canine level, which is kind of nice. I'm not sure that we control the torque perfectly, but that was a good result. And you can see here that it was not corrected perfectly. It's not a material problem. It is probably a lack of IPR. So if IPR had been done a little bit better, just a tiny bit better, I think would have been a perfect case within 4 months. Then we have another case right here. I'm not going to bug you, but this I did it myself to show you that we can get the green is before and the purple is after 10 trays. You can see that the teeth are doing what they're supposed to do without too much uncontrolled tipping. So again, after 10 trays, again, this is not material problem. This is IPR. We should have done better with the IPR, which, by the way, we're all guilty of. We all do 25% less IPR than the software tells us to do for whatever reason. So it's better to err on the less than more, to be frank with you, and do a refinement than doing over reducing of enamel because we don't have that much and it doesn't grow back. So I would argue that it's better after 10 trays to see this result and say, oh, I didn't do enough. Maybe I should do a little bit more and finish the case. That's my humble opinion. And that's before and after 10 trays, which I was doing a refinement. I don't have the pictures to show you, but I would argue that probably the case is not done. Okay. So what is so important? The moment to force ratio. Every paper I read is about force. Can a liner give us the force? And I'm going to tell you a big secret. Yes, they can. Force is easy. They push. They will push and push and push. The big problem is to be able to create couples. And that's the biggest problem, which Burstone has so well described with the moment to force ratio. If you don't have the right moment to force ratio, you will not do good orthodontics. It's that simple. And it's the same with the liners. Okay, so I'm going to go quickly because again, I'm going to run out of time. So if you do uncontrolled tipping, moment to force ratio is 3. Aligners will do this with no problem. Then you move on to controlled tipping. It's 6. Aligners can do this too, probably with a little bit, sometimes with probably with active memory. This is highly predictable. Then you go to translation, and that's 10 to 12, 12 per canine, 10 for an incisor. This is when people say, well, aligners can't really do that without significant amount of attachments. And I would argue that it's true. It depends on the anatomy of the tooth. So every patient is different. People with super long teeth or short roots, whatever, are different from people with long roots and short teeth, short crowns. You'll know that. So it depends on your patient. This would probably need attachments or reverse attachment or some form of more thicker material, whatever. This is the biggest problem. This is root movement. You need 18. The amount of torque you need to put on this is very high. And people say it's not feasible. We are working on this at the moment to see how much can we put into the system to give you the correct amount of, sorry, the correct amount of torque, moment to force ratio, sorry. Oh yeah, so this is now the way people talk about aligners. This is not good. This, we put an attachment, we mimic that this is actually a bracket, we have a force, we put a counter moment, and we get the translation. In reality, with shape memory or active memory polymers, the aligner is englobing the tooth, engaging every single undercut as much as possible, and then you get this tiny moment called distributive moments and force fields. Again, that's a whole lecture. But this is completely different from that and completely different from fixed orthodontics. So please, when you are planning your cases, try to remember this picture. It's not the same. And when the tooth moves, what happens, all these little arrows will move with the tooth and change direction. So you kind of have to calculate these to get the best possible outcome. And that may explain why, with such a great accuracy, you can go with no attachments for simple movements and less attachments for more complex movements. So the stress distribution I was talking to you about, I'm not going to spend too much time, is when you have a problem with an attachment, you will distribute the stress right here, and all the rest of the aligner will basically do nothing. So this is very important to have a wide depression. You see, this is the paper. I had the paper to show you, but I just noticed that it's gone. So this is very important for us. This is what we're working on. So how do we do it? Well, if you have a very like power ridge, which is very tight and very deep, it's not a good idea for active memory. What you need to do, you need to make these depressions right here and right here. And this one will avoid stress concentration and give you potentially what we have been looking for, which is the holy grail eventually, is to give you this, which is the right force couple that will create translation or potentially torque. I mean, controlled torque. So this is what we're working on at the moment. It's still a work in progress, but I'll show it to you. So we also have a problem with the biological reality and the current practice. We don't really know which we should be changing aligners at the moment. We went from 14 days to 7 to 3 to 7. It's very difficult to control because bone remodeling is an individual process. Every patient is different. Every side of the patient is different, as you know, and every single tooth movement is also different. So I'm not going to spend too much time on this, but at the moment, we are still very much working on this. All I'm saying is changing aligners too often is not the best idea. So that's why the reactivation of Lux Cryo is better because you can make a little bit more activation in the aligner, let's say 0.3 instead of 0.2 or 0.35, whatever, and you reactivate it every day and you wear the aligners for 14 days. So you reduce the number of aligners, but you also get the correct moment to force ratio because you have reactivated the aligner every day. So these are observations you always see. No aligners. Do not use these because you're going to introduce creep like crazy. So you will deform your aligner. How do you call this? The little softies that we used to bite with Invisalign. Bad idea. Okay? Because you are going to deform this aligner right here. It will fit, but it basically does nothing. Okay? So what do we want? This is thermoform. So you put it in, you have a lot of force, decays, nothing happens. A lot of force, nothing happens. A lot of force, nothing. So do you get the force? Yes, you do. But you need a long series of aligners. You need a large number of attachments to get the moment to force ratio you need. Ideally, with an AMP, which is you get a light and continuous force, which has been proven to be the best way, especially with night eye for the past 40 years, is yes, do you get force decay? Yes, you do. But then you reactivate, and then you reduce the number of aligners and you get into a higher moment to force ratio. So this is the take-home message. Like continuous force system. Remember, I showed you 6 to 4 in reality because you are losing energy in the system. You're going to get into the 2.5 Newton to 4 Newton. And again, it's a viscoelastic system. So even this 4 Newton does not express as much as you think at the PDL level. So I think you still need a bit higher forces that we would think with a night eye wire as an example, we will put 90% of the force to the system. Okay? So what about attachments? So I saw in the introduction, no attachments. I agree with them on simple cases, but in academia, we don't do simple cases. So I would argue that probably we're still going to have to look at some attachment systems when we do torque, or we do, it could be reverse attachment, mind you, and when we do translation. So this is a work in progress. So again, can we anchor an intrusion with two, which I would do with 2 attachments on a thermoform, or is the undercut system enough to do this? I would argue for the case like this one, probably this would be enough if the anatomy of the dentition is good enough. Okay, so this is force driven. I'm running out of time, I think, so I'm not going to spend too much on this. So I'm going to forget about that. Okay. So again, this is important. So you can see now that when you let's assume you put an attachment, you're gonna get a lot of surface right here, and you can also print your liner with a void here to make sure the tooth is gonna move faster. You can make a smaller attachment or decide that this is enough to pull the root and the crown at the same time. If you can say, I need control tipping, that would be probably good. I need a real translation. Maybe a small attachment will give you what you need. So that's what I'm talking about. So does it work? So this is a little experiment we did. It's not a great one yet, but it's pretty good. So what we did, we went from 4 millimeters, okay, pre-treatment, to after 12 trays to 2.8 with no any sign of tipping, and this is 2.8 instead of 2.73, which is what we had planned in the case. So basically, we're able to get a millimeter to a millimeter and 3 in 7 and 12 trays, which is not a lot. We could have probably gone to a higher level of activation, but is again, and there is an attachment here, you notice? So there is still, we're still out in the research phase of this, but the material is really nice. Okay. Great case for my friend Kelvin. I'm going to show it to you quickly. By changing the trim line, you can definitely print a special trim line, put a special button, run an elastic, make two little notches in your liners, and print it. Yeah, this is the trim line system that I just showed you. And then in the old days, we used micro implants for that. We might look at the two systems right here. I'm not going to pass the movie because I have no time. Sorry, they forgot. I think they forgot to show me the finished case. I do apologize. I had the finished case. It's gone. Sorry about that. But basically, what happened? We're able to intrude the tooth. That's a bad deal. Anyways, okay. So, what about distalization? We have a project. University in China is looking again small attachments using Lux Creo material, and within 7 trays, you can see they get 1.4 millimeters. So it's a 0.2 activation, and they get really nice distalized, really nice space opening. Some people argue that maybe the anterior part of the dentition comes forward, but no, it doesn't, because you see there is very little residual force with the blue. So the teeth are actually, the red is actually the movement. So you can see the movement is concentrated on the second molars. There is tiny amount of reaction forces expressed there, but at the end of the day, you get pretty good. There's a bit more uprighting in the back on the lower, so probably you have to be more patient. On the upper, it's nice because the bone is less tense. You can see a difference. This is translation. This is kind of uprighting. So on the lower tooth, probably we could wear the aligners a bit longer, maybe make a bigger attachment. I don't know. And on the upper, you can just continue because it's a different bone architecture. What about bite opening? Another case, last case I'm going to show you. So that's a fairly simple case with some deep bite, class 1 molar, some anterior crowding, some rotations, treated with 30 trays. And what happens again, you can see the rotations are almost corrected. There is a change in the arch form. The bite is open, and we now have the same issue as we usually do, is this clinician did not do as much size PR or didn't push the teeth as well as they should have been. So we have a mini incomplete treatment, but anything with a good refinement can take care of. And again, because it's a fairly new case, you can notice that it was done with a lot of attachments at the time that we can argue could be probably reduced, but it still proves that the aligner material is actually working as predicted. We also tended to go more trays because that's a fairly new case for about 2 years ago. So we put more trays. I would argue that you could probably get to the same level with about 20 trays and a little bit more activation at the tray level. So the superimposition proves you again that there is some controlled tipping of the dentition. You can see the apex stays at the same place. There is controlled tipping. Could be an even bit more intrusion of the incisors, and the patient was still pretty satisfied with the result. That's the superimposition, what we did between the purple and the yellow. So yes, we pushed the teeth slightly forward as shown on the Ceph. We reshaped the arch, and the upper was the same. Again, not full correction, but probably with rotations, even if you use a thermoform or ActiveMemory, I would argue that overcorrecting may be a good idea. And if I had to do it again, I would probably make the aligner thicker here and thicker there and thinner here, so to promote even more rotation. So that's new. Again, we learn from every case we are treating. And you can see what happens, the concentration of forces, and a lot of concentration were right on the incisors. This is exactly what we wanted. A little bit here, a little bit there, and on the lower, it was more even. And sorry, it was more even here at the transverse level. So the conclusion, I think I'm right on time, hopefully, because I tend to talk too much as usual. The future is here now. We just need more. I mean, again, Lux Cryo is a great, my opinion is I'm working with on the academic level more than the sales. I'm not a great salesman, as you may have noticed. And I'm looking at a lot of schools who are very interested to get into the program. We are going to be publishing a significant amount of papers that will hopefully validate my claims. And this is why I was attracted to this company because they are very serious and they are very academically oriented. They're a bunch of engineers, and this is why I like working with them. It's obvious that I have a conflict of interest now, and I'm a little bit biased, as you know, but I think this company offers great materials and will, especially with the service that is offered, you can try with some patients and see if you like it. So it's something else. It's biocompatible like Lile was saying, higher precision, we talked about that. This is super important. If you don't reactivate the polymer, don't bother, basically, because it's not good. You have to reactivate. The patient has to know and has to be on the program. Otherwise, you're wasting your time. And at the moment, we have proven that we have equal outcome with less aligners for moderate cases. Now we're going to start doing much more complicated cases with a few schools, and then hopefully I can come back and present the results. And the problem I'm having is the biggest issue we have, and I've been discussing with the company, and everybody's aware of that, is the simulation software is actually it's actually designed for thermoformed. So we are not optimizing yet. We are still using Lux Design to optimize more, but within the near future, we will be able to have a software that is fully adapted to the unique characteristics of these polymers and hopefully result in much better outcomes, faster treatment, because as we all know, patients get fed up with 80, 90, 100 aligners. So we have to come to 20 to 30 to 40 maximum so we get to the right outcome very quickly. I do apologize. Sorry, I'm coughing a lot. So I'm done. Hopefully, I didn't take too much time. I don't know, Lile, if I'm good.
You're perfectly on time. Thank you very much.
Okay, and I will hopefully didn't talk too fast as usual. I do apologize for the non-English speaking audience. Hopefully, you could understand, but I think we have a replay on Monday or something, right?
We
So
do. We will have also a recording that we'll share with the audience so you can view this again at a different speed if you want. But I actually think your speed was pretty adequate.
okay.
A lot of material that you shared. Thank you very much. Wanted to quickly react first two things. One is yeah, for the case with Kelvin Chang where you saw the intrusion with the extension of the trim line. Apologies for this, but those of the audience who have attended the webinar by Kelvin Chang recently will have seen the output. It was indeed quite impressive as how this was done. So, but thanks for mentioning that. And then you also mentioned the fact that indeed a lot of the existing treatment planning software are made with thermoform in mind. And there's been a lot of questions around this in the Q&A. So maybe we can start with that, Professor Retrouvé.
Yeah, let me do one thing, please. Let me do this. Yes. Can I share my screen again for like
Let me
30
stop
seconds?
sharing mine. Well, maybe before you share your screen, then I'd like the audience
Yeah,
to take a
I'll
quick
put, if they
screen.
want to see the case, I will put Calvin's case at the end of the question because I have it.
Oh, but I think that's fine. I think there was more questions in the Q&A respective to thanks to the reactivation that you explained so well that recovers the force and
Yes. So let's do it.
how does that impact the duration or the control of a case? What is your perspective on this with regard to what you can expect from a AMP based treatment versus an old thermoformed treatment?
Well, The idea is I showed you the curves. I know curves and dentists don't go well together, but that's okay. The graphs, okay? But what is basically happening is, sorry, my voice is failing me. If you don't reactivate, basically you could think of in a very simplistic way, Lux Cryo is a thermoform aligner. Dude, boom. Okay, so every day you put it in your mouth and it starts with a high force and it goes slowly down, down, down if you don't change, if you don't reactivate. But because this polymer is unique, what happens is if every day you reactivate, you go above the transition temperature, what will happen is it will reactivate to its original shape. So you basically get an aligner, a brand new aligner every day. And the force distribution is much better because compared to a thermoform, it will engage undercuts and be almost hugging the teeth and even the small attachments if you use them much better. So you have to change the way you think about using a Lux Cryo. You have to probably increase the amount of activation. If you do a simple case like tipping, you can go with higher activation intervals. So you have less aligners, less attachments, obviously. The only question I'm having at the moment, if I do a canine which has a super long root and I need a high moment to force ratio, I need to reactivate it very well, maybe every 12 hours, and maybe just put zero point 0.2 millimeters of activation to get the translation I want. This has to be verified. But at the moment, we have proven, even the papers prove that shape memory and active memory are at least as good as thermoform. So already there is an advantage. Are we going to
Yeah.
get so much better? I don't know. This is something that will come in the near future.
Right. Thank you. No, and I think it's important because, as you mentioned, I mean, we have proven that we are equally good
Yes.
already, I mean, as thermoformed. So I was just reacting to the fact that as we can reactivate the aligners, that's where we believe the superior performance will actually really show. And some of the questions were exactly as you were asking. Can we shorten the duration of the trays, and can we expect more activation in terms of displacement and rotation? Maybe one more question on this, and that to echo some of the
Sure, go for it.
Q&A questions. You did show that the moment to force ratio that an aligner can actually deliver, and particularly with thermoformed, was actually decaying over time. And you've basically
Yes.
also shown some movements and displacements that require a high moment to force ratio. So, can you comment on this as to then if you have an aligner whose force is actually very low from the beginning, does that correspond to the moment to force ratio that's further down in the decay? What does that explain from
Well,
that perspective?
that's a great question because I don't live in the PDL, so I don't know. What happens is uh, other companies says you need a very light force, and this is an advantage. Yeah, probably for uncontrolled tipping. The problem is when you start moving big molars and you move big canines, you need in orthodontics, we'll know that we need at least 150 to 200 grams to move a canine with braces. Okay, there is some friction and ortho, but whatever, regardless. So you have to reproduce this with an aligner that is capable of giving you this moment to force ratio, but with a force that is above 100 grams, which is 1 Newton, and maybe even two would be better because remember, the polymer will lose a lot of its energy just by inserting in your mouth. So 2 to 3 Newtons get maybe one and a half that's the simple force, right? But then you need also the counter moment to make sure that the crown is gonna move distal. Let's assume you do a canine retraction. The crown is gonna move distal, but you also need to get the root distal, and you need to apply a constant pressure to get constant remodeling, which is called primary bone resorption. I think that's why I agree, and I don't agree with Lux Cryo. I think I agree with Lux Cryo for no attachment for simple cases, for uncontrolled tipping and controlled tipping and some rotations. But for canine retraction, I think we need a higher level of force system, which I think, and it's not proven yet, I think the aligner system from Luxro can deliver if we do it correctly. And this is another course. It's all in the staging. It's all in the way you do it. And I think there is a great potential to research that. So yes, you still need 150 grams of force to move a canine. You cannot do it with 12 grams of force. Not going to happen.
Thanks. So I think thanks for that clarification. I just wanted to say we are actually very supportive of attachments when they are needed, and you've given
Yes.
a lot of examples where they are. I think what we want to emphasize is that it's a real selling point where you can reduce the size or actually completely remove the attachments on
Yes.
the social teeth, for example, which then adds a lot of value to the patient. But
Absolutely.
absolutely.
No, no, I agree with
One
you. Yes, sorry. Go for it.
one question is a math question because when you express that some difficult rotations or tipping movements require, or torque movements require high moment to force ratios, when you look at the math, it's tempting to take moment divided by force. Therefore, when the force decreases, the moment to force ratio increases. Can you just highlight how we should be interpreting these terms? Because obviously it's the moment to force that we need to deliver that's changed. I mean,
Yeah,
can you clarify that?
that's the big misunderstanding with Dr. Burstone. Took me many years to get it. Is basically what Dr. Burstone was talking was counter moment. He just forgot to put counter. So what happens, you put a simple force on the crown because it's at a distance from the center of resistance, especially on the canine, it's pretty far. So even if you put 100 grams force on the crown, let's say on the bracket, or with a liner that really hugs the crown, what happens? The 100 grams of force will produce probably 1200 grams millimeter of moment who's going to be trying to basically tip the tooth, which is fine. Okay. Then what Burstone said, oh, that's the moment to force ratio. No, this is okay. That's the moment created by the force. What is the ratio is the counter moment. Can I create a negative moment that will cancel the moment created by the force? So if you are able with your attachments, with the hugging of the crown by the aligner, can you produce these 1200 gram millimeters of force? Then you get the correct moment to force ratio. So yes, if you reduce the force, you will reduce the moment that it produces, so you don't need to put such a big counter moment. They are independent of each other, by the way. That's the big problem that Aristotle never really explained well. The force that you use for a power chain on a bracket and the counter moment delivered by the wire or by a bend you put in the wire are independent of each other, but they have to be equal and opposite. Otherwise, you have no translation. So what's the thing with aligners is you have to be able to produce this counter moment and have it equal and opposite if you want translation. But if you want torque, it has to be bigger. So this is the problem. I don't want to spend too much time on that. That's mathematics. But if people are
No, but I
interested
think
in
it's
the
clear because indeed it's a confusion. Otherwise, we tend to
yeah,
think like the denominator becomes smaller and therefore the moment of force increases. And then you're going to look for the solution that drops the force as fast as possible, which is obviously exactly the contrary that we heard from you today. And
yeah,
so thanks for that
yeah. Think of
clarification.
them as independent. I
Thank
need
you.
to put a force. I need to put a moment.
Thank
Yes,
you.
the force produced the moment, so I need to kind of play with that. It's kind of playing with the moment to force ratio that you are applying. So one moment and one force, can I? And again, it's a big conversation, and I'm taking already too much time discussing this. It's another webinar in its entirety.
Right. Well, I mean, for those who need to go to another commitment, I know we're 5 minutes past the hour. I will maybe go for a last question that we had received in the early
Sure.
pre-questions. So can you explain, I mean, the benefits and the real impact of increasing the trim lines to engage more of the gingiva or different parts of the dentition and the benefits from this thanks to direct printing technologies like Lux Creos.
Oh, by the way, yes, you have to understand again because of thermoform. What people don't get is Luxco is pretty smart too, by the way. And again, I'm not a salesman. I was surprised by Hector showed me that about 2 months ago. What they do is they actually make the trim line thicker. So we always think because it's thermoform, we have to make it longer, right? Because that's all you can do with thermoform. So I'm going to make it 5 millimeters above the gingiva so I can get more plastic, supposedly a better concentration of power because when the tooth wants to move away from the plastic, I got a longer plastic sheet. So it should resist this tipping better, which makes torque, whatever. But LockScrew is smarter, in my opinion. What they did, you can vary it, you can vary the length, but you can vary the thickness. That's why when you get a trim line from LockScrew, they'll tell you, do not cut the trim line because the trim line is actually thicker. So if you take it out, you have a problem. So then you have to think in 3D. This is the big advantage of, again, these polymers is they come from a 2D, which is a suck-in 2D XY coordinate to an XYZ. You can make it thicker, you can make it larger, you can make it whatever you want. And the trim line at the moment, I would argue, put a small trim line like I showed, but then if you want more torque, make it thicker. And then that's it. You get more rigidity and you get the same or even better force distribution that with a longer trim line. And
Thank
you
you.
can marry both, make it longer and thicker if you want to. It's up to you.
Thank you. I will close this with one remark and one question that going to read out because I think it's a very interesting question. First, the first comment is that I'm sharing my screen so you can actually, as the audience, take a picture of the social media streams that LuxCreo has, whether it's the Instagram, the Facebook one, in addition to reaching out directly to us, of course. And Dr. Salvati, he is reading this question. Dear Professor, given the thermally activated behavior of shape memory polymers, and I believe Dr. Sabati means active memory polymers
Yeah, could
used
be.
in next generation aligners. To what extent do these time-dependent biomechanical characteristics affect the predictability of tooth movements in the early versus the later phases of activation? And then congrats for the passion. So could you comment on the predictability, please, Professor?
Well, the predictability is simple. It's time dependent. And I show a big equation with tons of t's in there, which I didn't do today. Time is everything. So the problem we have with aligners is unlike fixed orthodontics, the wire is stuck to the bracket and it has to express its energy somehow. With aligners, if the aligner for whatever reason start to disengage from the attachment from the tooth, your time is dead. It's not doing anything anymore, or it's doing things that you don't want it to do. So the big advantage of the reactivation is theoretically, again, theoretically, because we still haven't proven it, but it looks pretty promising. Looking at the papers that I've been reading, is theoretically this contact, this intimate contact between the tooth and the attachment and whatever it's going to be, and the polymer is restored every day. So you don't have any decay in the contact. Then, according to Harry and all his research, which is the head engineer, you have no decay in time of the power of the polymer. So theoretically, you have a brand new aligner every day that gives you the correct force system. But again, it's still a removable appliance. So you're going to be careful with it and make sure that you are grabbing the tooth correctly. So that's why I agree with Lily about the no attachment for simple cases, moderate, 40, 20, whatever. But I'm much more interested in much bigger cases. In my opinion, we need to study how can we grab the tooth so to make sure that this intimate contact is not lost. And I call this the law of diminishing return, meaning that if you have a little bit of loss on tray one, a little bit of loss on tray two, on tray four, and tray five, then at tray six, nothing works anymore. You have to do the whole thing again. So that's again a different discussion called the constant refinement concept that I'm defending, and I think LuxCreo will be a great company to develop.